My name is Schmiedeskamp-Rahe, and I'm a clinical pharmacist at University of Illinois at Chicago. I did my training here 12 years ago with our transplant surgeons taking care of liver transplant patients. And then for the last 12 years, I've been helping our liver doctors care both for our patients who are waiting on the transplant list, our patients who have had liver transplants, and our patients who have been newly diagnosed with severe liver disease. And I was asked to come here today to talk to you about some tips for managing your medications when you have severe liver disease. The main group of people I want to address today are those of you who have cirrhosis. But I want you to keep in mind that not everybody with cirrhosis is exactly the same as every other person. Some people with cirrhosis feel just fine. They have normal lab values. And their liver doctor really just checks up on them once in a while to make sure their liver is still doing. Just do your best to come for your appointments because your doctor wants to be absolutely sure you don't have any liver issues brewing. However, if this is you, you may not have very many restrictions on your medications. Often there aren't restrictions on medications for this type of person. You should be sure to ask your doctor if this describes you. On the other hand, some people with cirrhosis have lab values that are showing their physician that the liver is failing. Often people in this situation feel very ill and they start to have symptoms like ascites, which is a collection of fluid on their abdomen, like varices, which are swollen blood vessels in their throat, jaundice, which is a yellowing of the skin or the eyes, and they may also have encephalopathy, which is a confusion that patients with liver disease frequently get. If this sounds like you, then it's quite possible your liver doctor may already be talking to you about liver transplant. For people in this situation, there are medications that can help improve your symptoms, and there are also some rules of thumb about medications that can be harmful, and I want to go over these. The first medication that I want to talk to you about is a very common medication for my liver patients, and this is Lactulose. Lactulose is often taken by people with severe cirrhosis to help keep you from getting confused. It's an interesting medication. It's a liquid. It tastes very sweet like a sugar, but it's not actually a sugar that your body uses. It's a sugar that the bacteria in your gut use. And when the bacteria in the gut use this sugar, several things happen, including a laxative effect. And so one of the ways that lactulose works is it carries toxins out of your body in your bowel movements to prevent them from going to your brain and causing confusion. So the rule of thumb, if you take lactulose, is that it works best if you take enough lactulose each day to have about 3 bowel movements. Some people are told 2 to 3. Others who struggle a little bit more with confusion are told 3 to 4. If you haven't been told by your care team how many bowel movements a day you should have while you're taking lactulose, you should ask them. Many doctors do allow their patients to adjust their dose of lactulose at home. My liver doctors generally let our patients do this. And so if one of our patients has already had 4 bowel movements by the time of their last dose, our doctors will let them skip it. And if by the time of their last dose they've only had 1 bowel movement that day, our doctors will give them the advice that they should make the decision on their own to take an extra dose or 2. So you need to make sure your care team has given you some pretty specific instructions about how they want you to take this drug. If you're turned off by the super sweet taste of this drug, there are things you can do. You can mix it with water, you can mix it with milk or fruit juice to make the taste improved. I also recommend that you use an accurate measuring device to measure this drug and not just some sort of household spoon. This is so that you can keep track every day of how much you've taken, and then if your dose needs adjusting or you need to communicate that information to a healthcare provider, you'll know exactly how much you've taken. Your pharmacist can give you a measuring cup. I've got a picture here which will measure it out in milliliters for you. Another very common drug my severe liver cirrhosis patients take is rifaximin. This is also a drug intended to help keep you from becoming confused. The brand name is Xifaxan. We often turn to this drug for our patients where lactulose is not enough to keep them from getting confused. Rifaximin is easy to take. It's a pill you take twice a day. It's an antibiotic, but it's one that your body does not absorb, and so most people don't struggle with side effects with this drug. However, Xifaxan is expensive. Without insurance, right now it costs nearly $3,000 per month. And so if you've had the experience where your physician has prescribed Xifaxan, but at the pharmacy you've been told a very, very high price, you've probably felt helpless, but there are things that you can do. Number one, if your insurance does not cover rifaximin, your physician can request coverage through a process called prior authorization. Because of the cost, many insurance plans don't automatically cover this drug, but many of them, if your physician requests permission, they will extend coverage. Number two, if you have no insurance for medications at all, you can ask the people in your clinic to help you contact the manufacturer and fill out paperwork requesting manufacturer assistance. People without insurance, if they meet certain income requirements, can have the medication provided to them directly by the manufacturer. On the other hand, if you have commercial insurance, that is insurance that's not government sponsored, such as Medicare or Medicaid or VA benefits, you may be faced with a copay. Even insurance companies that approve the drug or have approved a prior authorization impose a copay on the patient. However, the good news is that there is a copay card available. Many doctors' offices keep a stack of these, but you can also take this matter into your own hands and download a copay card from the manufacturer website. And after answering a very short questionnaire, you can print this copay card out and provide the information to your pharmacy. In many cases, when you have commercial insurance, it reduces the cost to zero. People who have Medicare or Medicaid or other government insurance, such as VA benefits, cannot use this copay card, but if you find yourself facing a very large copay, don't despair. Ask your clinic to help you fill out paperwork directly with the manufacturer approving your income, and you may be able to get assistance from the manufacturer. Another class of water drugs that many of my liver drugs that many of my patients take are water pills. These are used to control extra fluid in your system. So if you have fluid in your abdomen, that's what's called ascites, or if you have fluid building up near your lung, which the doctors call a pleural effusion, or if you simply have swelling in your legs, you may benefit by being on diuretics, also known as water pills. Taking these can help get the fluid under control. This can make you more comfortable, and it can also help prevent the need for the physician to drain that fluid with a needle. If you do take water pills, you need to follow the instructions that your team gives you about getting your labs checked. They're going to want to make sure your kidneys are okay and your electrolytes are okay. And this is because water pills can cause you to become dehydrated. I recommend that you don't take your dose of water pill right before bedtime. Taking the last dose a little bit earlier in the evening or even in the late afternoon can help keep you from being up all night urinating. And in fact, many patients are able to take all of their water pills all at once in the morning. So if you are somebody who's having trouble with nighttime urination and you do take a water pill, you should speak to your care team to find out whether it's possible to move the dose earlier in the day or consolidate your doses in the morning. Common names of water pills that cause problems with nighttime urination are drugs like furosemide or Lasix or torsemide or bumetanide. If you take water pills, you also have to keep an eye on your sodium. Water pills won't work to keep your swelling and your fluid under control if you eat too much salt, and salt is everywhere. It's common in packaged foods and TV dinners and canned vegetables and soups and crackers and chips. And these are the types of foods that you're going to need to stay away from. We also recommend that you don't cook with salt or actually salt your food after cooking. The rule of thumb is that patients with severe liver cirrhosis should not eat more than 2 grams of sodium each day. that works out to 2,000 milligrams of sodium. So you're going to need to read package labels if you're somebody with severe cirrhosis. What you're looking for on the package label is sodium. This is an example of a very small bag of snack chips. And you can see that in this tiny bag, it already has 350 milligrams of sodium. And this is about a fifth of what my severe liver patients are allowed in a single day. And so you're going to have to be a very careful reader of packages. Another class of drug that many of my liver patients take when they have severe cirrhosis is antibiotics. If you have ascites fluid in your abdomen, your care team may decide to prescribe you antibiotics to take every day for basically the long term. The reason for this is to help keep that ascites fluid from getting infected. This is very common for people who have had an infection. Those people who have had an infection of the ascites should be on antibiotics, and many other people are assessed as being at high risk for getting an ascites infection and are given long-term antibiotics. If you're prescribed antibiotics by your physician, you should clarify, is this for the short term or is this for the long term? And if it is for the long term as a preventative measure, if you run out, you need to make sure that you get more. Another class of drugs that's very common in my severe liver cirrhosis patients are called beta blockers. The reason that we use them is that some people with severe liver cirrhosis have very large blood vessels in their esophagus, which is essentially the throat, called varices. If you're someone who has varices, your doctor has probably discussed with you that it's possible that they could bleed. And certain patients are placed on beta blockers to prevent bleeding. So if your varices have ever bled, or if your doctor assesses that your varices could bleed, they may place you on a medicine called a beta blocker. Some common names you may hear when discussing beta blockers are carvedilol, nadolol, or propranolol. Probably the most common brand name you hear is Coreg. If you're on a beta blocker, your care team is going to monitor you for your blood pressure and your heart rate because beta blockers can reduce both of those. One way that you might realize that your beta blocker dosage isn't being well tolerated by your body is if you become dizzy. So if you're on a beta blocker and you start to become dizzy, this is something you would want to let your doctor know. Generally, the advice, though, is don't stop your beta blocker suddenly without the advice of your doctor because this can cause your blood pressure to jump. When you have severe liver disease, it's super important to take your medications as directed. This will help you manage your symptoms and prevent problems. Many of the medications that we give our patients with severe liver disease are given to try to hold off problems. Taking your medications as directed may help keep you more comfortable, and it may also help keep you out of the hospital. It's also very important that you know if you are considering liver transplant, that your transplant team will be assessing your ability to cooperate with instructions while they evaluate you for liver transplant. This is because liver transplant is a very complicated procedure. Many medications are required after the surgery, and they need to know that this is a situation you'll be in a position to manage. And so just as they will evaluate your ability to follow up in clinic and get your labs drawn and follow up with phone calls, they'll be assessing your ability to take your medications. I want to switch now to over-the-counter drugs and warn you a little bit about them. I think many people perceive that because some drugs are available directly off the shelf in the pharmacy, that must mean they're perfectly safe. But I wanted to let you know that just because a drug is available over the counter in the pharmacy doesn't mean it's necessarily safe if you have liver disease. Not every OTC drug is right for every person. So if you have liver disease, you should ask your doctor before taking OTC medications. There are some general rules of thumb, though, that I can share with you about patients with severe cirrhosis. Probably the most important rule of thumb about OTC medications and cirrhosis is that people with severe cirrhosis should avoid the OTC painkillers that are called NSAIDs. These are non-steroidal anti-inflammatory drugs. Names that might be familiar to you are names like ibuprofen or naproxen, or brand names like Advil or Motrin or Aleve. These are very common drugs, but they have serious consequences in patients with severe cirrhosis. They can increase the risk of bleeding by blocking the function of platelets, which are tiny cells in the blood that help form blood clots. They can increase the risk of kidney injury by reducing blood flow to the kidneys, and people with severe cirrhosis already are at increased risk of their kidneys becoming injured. These drugs can increase water retention, and this is inconvenient in people who already have ascites and who already have swelling. And they also can increase the risk of stomach ulcers. And therefore, for anybody with severe cirrhosis, the advice is to avoid over-the-counter and prescription NSAID drugs. On the other hand, if you have severe cirrhosis, you may be surprised to know that your doctor may let you take acetaminophen, so you should ask. Acetaminophen in overdose can be associated with toxicity to the liver, but taken in small quantities, even for people with very severe cirrhosis, it can be quite safe. And therefore, many liver patients with severe cirrhosis are allowed to take up to 2,000 milligrams of acetaminophen each day. I would warn you, though, that those who have cirrhosis and who also drink alcohol need to avoid acetaminophen. And in fact, anybody at all with or without liver disease who drinks 3 or more drinks per day is advised to avoid acetaminophen as well. And this is because of an increased risk of liver injury in people who take acetaminophen and drink in high quantities. So anybody with cirrhosis who drinks is advised to stay away from acetaminophen. But remember, if you have cirrhosis, you shouldn't drink alcohol at all to protect your liver. For those of you who have severe cirrhosis and don't drink alcohol, you may very well be allowed to take acetaminophen, and you should ask your physician. It's important, if you're allowed to take acetaminophen, to look for where it is hidden in medications. Many over-the-counter medications have acetaminophen in them. This includes many popular pain relievers, this includes fever reducers, this includes cold and flu remedies, and sleep aids even. And then you also have to keep in mind that some prescription medications also have acetaminophen, including drugs like Norco. So as you track your daily dose, be sure to include all of your sources of acetaminophen. It can sometimes be hard to find the acetaminophen in these products, so look at your products very carefully. This is an example of a sleep aid called Tylenol PM, and at first glance it doesn't say much about acetaminophen, but if you look very closely, there it is. It's in the list of ingredients. So this would be something that you would have to track as part of your daily allowance of acetaminophen if you are allowed to take this drug. This is another example of a packaging which doesn't, at first glance, seem to have acetaminophen. It says it's non-aspirin, but when you look a little closer, there it is. This drug has acetaminophen. The way to find out how much acetaminophen it has is to read the drug facts in the package labeling. Here we can see that this capsule has acetaminophen 500 milligrams in each caplet, and therefore you would have to add that in towards your daily allowance of acetaminophen. Just a quick note on street drugs or illicit drugs. If you have severe liver cirrhosis, it's important to avoid these, just in general, but I wanted to sort of give you a list of the reasons why. And some of them do have to do with medications and transplant. So if you have hepatitis C and you are considering hepatitis C therapy, it's important to stay off of illicit drugs in order to qualify for that therapy. We'll talk a little bit later specifically about hepatitis C therapy, but many insurance companies will not offer it to you if you are a user of illicit drugs. Staying off of illicit drugs is also important to qualify for liver transplant. In most cases, sobriety from illicit drugs is required for a period of time before transplant. But to go a little bit further, you should also know that bad batches of illicit drugs can cause liver injury. And if you have severe liver cirrhosis, you cannot afford any more injury. And certain drugs like cocaine can themselves cause liver injury. This warning extends to alcohol as well. Anyone with liver disease, if advised by their doctor, should avoid drinking alcohol because they want you to try to avoid further injuring your liver. But again, if you are considering hepatitis C treatment, abstinence is going to be essential because of insurance company rules. And then abstinence is also, in most cases, essential to qualify for liver transplant. Although certain exceptions are sometimes made, in many cases, they require 6 months of sobriety and often participation in a rehab program. A warning about herbal products. I didn't want to limit this discussion just to prescription and over-the-counter medications. Many of you probably have used or have friends who have used herbal products. The warning that I have is that no government agency checks these items for purity and safety before they are marketed. This is left up to self-policing by the manufacturer. The FDA, which regulates drugs in the United States, can ask manufacturers to withdraw their products, but this only occurs after the drugs are marketed and people are found to be harmed. And at that point, people have been harmed. And I'm not just talking about herbs that are dangerous to the liver in and of themselves. Some herbs are. You can find lists of these liver toxic herbs online. I'm talking even about herbs that have nothing to do with the liver, that aren't themselves known to cause liver injury or aren't used to treat the liver. If you have liver failure, you are especially vulnerable to liver injury if your herbal products are contaminated. And again, there's no governmental agency checking these products for contamination before they are placed on the market. And so if you were to get a contaminated herbal, if your liver is already sick, you very well might not be able to tolerate it. Furthermore, if you already have a liver transplant, the ante is upped even further because certain herbal products or their contaminants can interfere with the immunosuppression drugs that are protecting your new liver. And therefore, transplant patients should not take herbal products. So the bottom line is that I don't recommend herbal products for my patients with severe liver cirrhosis or my patients with liver transplant. If you feel very strongly that you must take these products, you should absolutely have this discussion with your physician before doing so. And then we should talk about prescription drugs, because just because they're prescription drugs written by a physician doesn't mean that every single one is correct or right for a patient with severe cirrhosis. And I'd say at the top of my list of medications like this are medications that can cause confusion because my patients with severe cirrhosis are already at such high risk for developing confusion because of their liver disease. And so medications that easily cause confusion, like benzodiazepines or sleep aids, are medications I would not recommend for a patient with severe liver cirrhosis. Names of brands that you might have heard are things like Xanax or Valium or Ambien or Lunesta. And I would say many liver doctors would agree and avoid these for their severe liver disease patients. This is a discussion that you should have with your doctor if another physician attempts to prescribe these. Some prescriptions also carry a risk of damage to the liver, which may not be terribly significant in somebody without severe liver disease, but becomes more significant in a patient with severe liver disease, because patients with severe liver disease may not tolerate any insult or injury as well as other people. And furthermore, some prescription medications actually need dose changes for people with severe liver disease. So even if it's a prescription from a doctor, make sure that that physician who is prescribing it knows full well that you have severe liver cirrhosis before you accept the prescription. And it's not a bad idea to always let your liver doctor know all the drugs that you're taking, or even bring the pill bottles to the clinic so that they can make sure that everything seems right and safe for your particular condition. One of the last topics I want to talk about is hepatitis C. Hepatitis C is really one of the most exciting fields of drug therapy right now, and really one of the most exciting aspects of liver disease right now, because just in the last few years we have an explosion of new drugs to treat hepatitis C. Right now the recommendation is that everyone born between 1945 and 1965 should get tested for hepatitis C by their primary care provider, because there are many people in the United States who have hepatitis C who are not aware. And then clearly people who have risk factors for hepatitis C should be tested, including those who have a history of IV drug use. If you and your doctor find out that you have hepatitis C, you may qualify for treatment, and there are many new medications that make treating hepatitis C easier and faster and more effective, and with fewer side effects than ever before. However, new hepatitis C medications are expensive. A single bottle of the medication often costs as much as a nice new car. A full course of treatment for hepatitis C can cost as much as a house. And for this reason, insurance companies are quite strict. They have a long list of criteria of the types of patients that can receive hepatitis C therapy, often including some sort of assessment of the degree of damage that the liver has already sustained. But then, very importantly, also requirements about sobriety. So many insurance companies require sobriety from both alcohol and illicit drugs before hepatitis C therapy is implemented, and often this is sort of engaged with the patient through a contract. So if you're thinking about hepatitis C therapy, you're going to want to know what to expect before you start. There's going to be quite a screening process to address these issues of alcohol, potential illicit drugs, cost, insurance coverage, and we know whether or not you meet the criteria. You should also be aware, if you get approved for hepatitis C therapy, that because of the cost, insurance companies can be quite strict and limit you to one course of therapy. And that would mean one chance at trying out this therapy for hepatitis C and hoping that you achieve a cure. And so if you're offered a chance of a course of drugs for hepatitis C, my advice is make it count. Don't skip any pills. Bring your medications with you when you travel, or if you come to the emergency room or the hospital, to avoid any potential for delay in access to your medications. If you're given directions for whether to take the medication with food or not, or to avoid certain medications while you're taking the hepatitis C therapy, follow those strictly, because for some medications, food or other medications can interfere with how the drug works. Make it count. And then finally, transplant. So if you're thinking about liver transplant, or if you're already on the list for liver transplant, you're going to have to think about what this means for your medication therapy. And what it means is you're going to be taking medications for life. You will always need immunosuppressants to protect your liver from the attack of your own immune system causing rejection. And you very well may need to take medications to prevent infections and to manage side effects. Sometimes these other medications are short-term, but sometimes they are long-term medications. And it's essential to take these medications to protect your new liver. The goal is never to miss a dose. Your transplant team is going to have all kinds of ideas for how you can get organized. Medication charts, medication teaching tools, pill boxes. They're going to have lots of ideas, but if you're considering transplant or you're already on the list, it's not too soon for you to start planning ahead for how you're going to get organized and take these medications for the rest of your life with the goal of never missing a dose. Protect that new graft. So this is the end of the material that I had today. My understanding is you will have a chance to ask questions that I'd be very happy to reply to. And I thank you so much for tuning in today.